What is going on, everybody on YouTube? Welcome back to my channel. For those of you who are new around here, my name is Michael, aka Dr. Cellini, and I'm a fifth-year interventional radiology resident physician. On today's video, I wanted to discuss the coronavirus and COVID-19 x-ray findings. And I was planning on making this video anyways, but then I saw this video that CNN posted about one of their main correspondents, Chris Cuomo, who is also the brother of Andrew Cuomo, the governor of New York. So it's been very public over the last few days that Chris Cuomo has been diagnosed as positive for COVID-19, and he's kind of been giving an update throughout his course and disease progression. In this particular video I saw a few days ago, they discussed Chris Cuomo's chest x-ray findings, and I feel like I could do a better job explaining it than they do. So we're going to go through this video and use it as a way to kind of discuss the chest x-ray findings of COVID-19 or the novel coronavirus and go from there. So let's go ahead, get into it. So like I said before, Chris Cuomo is a CNN news correspondent, which I see him all the time on this channel. He is the brother of the New York State Governor, Andrew Cuomo, which I actually didn't put two and two together for a while, but that's a different story. Last week, he tested positive for COVID-19, and they've been interviewing him almost daily about the course of his disease, and he does a pretty good job of opening up about it. So I'm gonna start the video. I'll stop it intermittently when I feel like I need to interrupt.
I feel better than I deserve. And I now know that I can't just take it from this thing. That when the fever spikes, you just want to curl up in a ball and stay there for the next 6-7 hours. And you can't. You've got to bundle up your clothes. You've got to start drowning yourself in fluids. You got to take your Tylenol, and you got to get after it. If you don't want it to get into your lungs, you got to force yourself to breathe. You got to get up off your ass. You got to walk around. It hurts. You don't want to do it. Everything in your body is telling you not to do it. And it's lying to you.
So I really like what he's doing here. He's staying positive, he's staying active, and he's mobilizing, which is fantastic. You don't want to just lay in bed and let this disease take a hold of you, if you can help it.
And it's lying to you. And I know that now. And the more I do, the more I push myself to do, the better I'm getting. So I'm going to take faith in that for now. I know I'm not through it, but that's good. Let's talk about the collective, though, for a second, though. Now,
so he's actually onto something with this, because when patients lay flat in the hospital bed on ventilators, the actual back or posterior of the lungs do not aerate as well because they aren't expanding, because that is the dependent portion of the thorax. So as you've seen in many cases with this virus, we actually prone the patients and allow the posterior or back of the chest to expand, which allows those airways to kind of open up. If you don't allow those airways to open up, that lung becomes collapsed or atelectatic and can cause that infection just to kind of sit there and not resolve. So I'm going to fast forward this part because they're just talking about data and whatnot. So I think